Understanding Concussions, a complete guide. This comprehensive guide explains what concussions are, how they affect the brain, and what you should know about prevention, recognition, and treatment. Whether you're an athlete, parent, coach, or just concerned about brain health, this information will help you understand and manage concussion risks effectively. Common causes of concussions. Concussions occur when a blow, bump, or jolt to the head causes the brain to move rapidly back and forth within the skull. This sudden movement can create chemical changes in the brain and sometimes stretch and damage brain cells. In the United States, millions of concussions occur each year across all age groups and from various causes. Sports-related injuries are among the most common causes of concussions in America, particularly in high-impact sports like football, soccer, hockey, and basketball. Athletes may sustain concussions from direct hits to the head, violent shaking of the upper body, or from hitting the ground during a fall. The competitive nature of sports, combined with the physical contact involved, creates an environment where concussions are unfortunately common. Falls represent another significant cause, especially for children and older adults who may have balance issues or age-related physical vulnerabilities. For seniors, even seemingly minor falls can result in serious concussions due to reduced tissue elasticity and age-related changes in the brain. Vehicle accidents, including car, motorcycle, and bicycle crashes, frequently lead to concussions when occupants experience sudden stops or impacts. Additionally, workplace injuries, particularly in construction, manufacturing, and other physically demanding industries, contribute to concussion statistics across the country. Signs and symptoms of a concussion. Immediate symptoms: confusion or feeling dazed, dizziness or seeing stars, headache or pressure in the head, nausea or vomiting, balance problems or unsteadiness, blurry or double vision, sensitivity to light or noise, delayed symptoms, memory problems, or amnesia, difficulty concentrating, sleep disturbances, sleeping more or less than usual, feeling sluggish, foggy, or groggy, persistent or worsening headaches, emotional and behavioral changes, irritability or unexplained mood changes, sadness or depression, anxiety or nervousness, more emotional than usual, personality changes. Recognizing concussion symptoms in others is crucial, as the injured person may not always be aware of or acknowledge their symptoms. Watch for changes in behavior, coordination problems, confused speech, or delayed responses to questions. Children and teenagers may show different symptoms than adults and may not be able to articulate what they're experiencing, making careful observation particularly important. The symptoms can appear immediately after the injury or may develop hours or even days later, underscoring the importance of continued monitoring after any head injury. When to seek medical attention. Red flag symptoms: repeated vomiting or prolonged nausea, seizures or convulsions, loss of consciousness for any duration, worsening headache that doesn't improve with rest, slurred speech or difficulty speaking, weakness or numbness in arms or legs, increasing confusion or irritability, one pupil larger than the other, unusual behavior or significant personality changes. Medical evaluation. A healthcare provider will typically perform a neurological examination, checking reflexes, coordination, vision, hearing, and balance. They'll assess memory and concentration through specific cognitive tests and gather information about how the injury occurred. Be prepared to answer questions about the injury mechanism, symptoms experienced, duration of symptoms, and any previous concussions or health conditions. This detailed history helps doctors determine the severity of the concussion and appropriate treatment. Diagnostic tools. While most concussions don't show up on standard imaging tests, doctors may use CT scans or MRIs to rule out more serious brain injuries like bleeding or swelling. Neuropsychological tests might be conducted to measure cognitive function, particularly for athletes. Advanced facilities may use specialized tools like balance assessment systems, eye tracking technology, or computerized neurocognitive tests to evaluate concussion symptoms more precisely. Always err on the side of caution with head injuries. A medical professional can determine if the symptoms indicate a concussion or something more serious. Even if symptoms seem mild, prompt evaluation ensures proper management and reduces the risk of complications or prolonged recovery. This is especially important for children and adolescents whose developing brains are more vulnerable to the effects of concussion. The science behind concussions, brain mechanics, during impact. When a concussion occurs, the brain, which normally floats in cerebrospinal fluid within the skull, experiences sudden acceleration or deceleration. Despite being protected by this fluid buffer, a significant impact can cause the soft tissue of the brain to collide with the hard interior of the skull. This collision can happen in two ways. In a coup injury, the brain impacts the skull at the site of the blow. In a contra-coup injury, the brain rebounds and hits the opposite side of the skull. Many concussions involve both mechanisms, creating multiple points of injury within the brain. Cellular and chemical changes. At the cellular level, a concussion triggers a complex cascade of neurochemical changes. The impact stretches and compresses brain cells, causing temporary membrane disruptions that allow potassium to flow out and calcium to flow in. These ionic imbalances lead to widespread neuronal depolarization and a surge in the release of excitatory neurotransmitters like glutamate. To restore normal function, the brain must work harder, dramatically increasing glucose metabolism. However, concurrently, cerebral blood flow often decreases, creating an energy crisis where the brain needs more energy but has less available. This metabolic mismatch explains many concussion symptoms and creates a period of vulnerability where the brain is especially susceptible to further injury. Cumulative effects. Repeated concussions are particularly dangerous because they can lead to cumulative damage. Research shows that the brain may not fully recover between injuries, leading to more severe symptoms with each subsequent concussion and potentially causing long-term neurological problems. Studies of former contact sport athletes have revealed concerning links between multiple concussions and conditions like chronic traumatic encephalopathy, CTE, a degenerative brain disease associated with memory loss, mood disorders, and cognitive impairment. Concussion treatment and recovery. Initial rest period 24-48 hours. The first 24-48 hours after a concussion require relative physical and cognitive rest. This means limiting activities that require mental concentration or physical exertion, including screen time, reading, and vigorous physical activity. Complete bed rest in a dark room is no longer universally recommended, but a quiet, low-stimulation environment is beneficial. Gradual return to activities, days 3 to 7. After the initial rest period, a gradual return to normal activities can begin as symptoms allow. This should follow a stepwise progression, where each new level of activity is only attempted if the previous level doesn't trigger symptoms. Light activities like walking or gentle stretching can begin, followed by more demanding physical and mental tasks. Controlled cognitive return, days 7 to 14. For students, a gradual return to schoolwork is important, potentially with accommodations like reduced workload or extended deadlines. Workers may need modified duties or shortened hours before returning to full capacity. The goal is to avoid symptom exacerbation while slowly rebuilding cognitive stamina. Full recovery, 2 to 4 weeks for most. Most people recover from concussions within 2 to 4 weeks, though children and adolescents may take longer. A proper recovery means all symptoms have resolved and normal activities can be resumed without triggering symptoms. Some individuals, particularly those with a history of previous concussions, may experience post-concussion syndrome with symptoms persisting for months. If not properly managed, concussions can lead to long-term complications. Returning to high-risk activities before full recovery increases the chance of sustaining another concussion while the brain is still vulnerable, potentially resulting in more severe symptoms and longer recovery time. Research has also linked repeated concussions to increased risk of neurodegenerative conditions later in life, highlighting the importance of complete recovery before resuming activities with concussion risk. Preventing concussions. Proper safety equipment. Using appropriate, well-fitted protective gear significantly reduces concussion risk during sports and recreational activities. This includes helmets for activities like cycling, skateboarding, and contact sports, headgear for soccer and wrestling, and mouth guards which may help absorb some impact forces. Equipment should meet current safety standards and be properly maintained, as damaged or outdated gear offers reduced protection. Creating safe environments. At home, reduce fall hazards by securing rugs, improving lighting, and installing handrails on stairs. In playgrounds, ensure impact-absorbing surfaces beneath equipment. In workplaces, implement comprehensive safety protocols, including proper training, adequate lighting, non-slip flooring, and equipment safeguards to minimize head injury risks. Education and training. Proper technique training in sports like football and soccer can reduce concussion risk. Teaching athletes how to tackle safely, fall correctly, and protect themselves during play is essential. Education programs should target coaches, parents, athletes, and the general public to increase awareness about concussion prevention, recognition, and proper response. Concussions in youth sports: unique risks for young athletes. Young athletes face distinct concussion risks that differ from adults. Children's brains are still developing, making them more susceptible to injury and potentially longer recovery times. Their proportionally larger heads relative to body size and weaker neck muscles provide less stability during impacts. Additionally, the neuroplasticity of developing brains means that injuries during critical developmental periods can potentially have more significant long-term effects. Research indicates that high school athletes take longer to recover from concussions than college athletes, and middle school students may take even longer. This age-dependent vulnerability underscores the importance of specialized concussion management for young athletes. Role of coaches and technique. Proper coaching and technique instruction are fundamental to concussion prevention in youth sports. Teaching age-appropriate skills, emphasizing proper form, and prioritizing safety over performance can significantly reduce injury risk. For example, teaching proper tackling techniques in football that minimize head contact, or heading techniques in soccer that reduce rotational forces on the brain. Coaches should receive specialized training in concussion recognition and management, as they are often the first adults to observe potential concussion symptoms in young athletes. Their ability to identify possible concussions and remove athletes from play is crucial to preventing more serious injuries. Return to play protocols. All youth sports programs should implement comprehensive return-to-play protocols that are more conservative than those for adults. These typically involve a gradual, stepwise progression from rest to light aerobic activity, sport-specific exercise, non-contact training drills, full contact practice, and finally, return to competition. Each step should take a minimum of 24 hours, and progression should only occur if the athlete remains symptom-free. Parental and school involvement. Parents and schools play critical roles in both prevention and management. Parents should ensure proper equipment fit, reinforce safe play techniques, and advocate for their child's health over competitive concerns. They must also be vigilant for concussion symptoms, as children may not report symptoms out of fear of being removed from play. Schools should implement comprehensive concussion policies, provide appropriate academic accommodations for recovering students, and ensure proper training for athletic staff. Debunking common concussion myths. Myth: concussions always involve loss of consciousness. Many people believe that a person must lose consciousness to have a concussion. In reality, fewer than 10% of concussions involve loss of consciousness. Most concussions occur without any blackout period, and even brief alterations in mental status following a head impact can indicate a concussion. This misconception can lead to many concussions going unrecognized and untreated. Myth: recovery takes a standard amount of time. There's a common belief that all concussions heal within a specific time frame, often cited as 7 to 10 days. In truth, recovery varies significantly between individuals. While many people recover within 2 to 4 weeks, others may take months, particularly children, adolescents, and those with previous concussions. Each brain and each concussion is unique, requiring individualized recovery plans rather than standardized timelines. Myth: helmets prevent concussions. While helmets are crucial for preventing skull fractures and serious brain injuries, they don't fully prevent concussions. Helmets reduce direct impact forces but can't completely eliminate the rotational acceleration that causes the brain to move within the skull. Modern helmet technology continues to improve, but no helmet can guarantee concussion prevention. This misconception can create a false sense of security and risky behavior. Outdated treatment advice. Many outdated concussion management practices persist in public knowledge. For example, the old advice to wake a concussed person every hour is unnecessary for most mild concussions and can actually impede recovery by disrupting sleep. Similarly, complete cognitive rest, avoiding all mental activities, is no longer recommended for the entire recovery period, as extended isolation can worsen symptoms through secondary effects like anxiety and depression. Another harmful myth is that toughing it out or playing through a concussion demonstrates strength or commitment. This dangerous misconception increases the risk of second impact syndrome, a rare but potentially fatal condition that can occur when a second concussion happens before the first has healed. Modern concussion management emphasizes that reporting symptoms and following proper recovery protocols demonstrates true strength and intelligence. Conclusion: taking concussions. Seriously recognize. Learn the signs and symptoms, respond. Seek proper medical attention, recover, follow complete treatment plan. Throughout this guide, we've explored the multifaceted nature of concussions, from their causes and symptoms to treatment approaches and prevention strategies. The science is clear: concussions are serious injuries that require proper identification, medical evaluation, and complete recovery. While most people recover fully with appropriate care, the potential for long-term consequences makes proper management essential. The key takeaways for everyone to remember are: concussion symptoms can be subtle and varied. When in doubt, sit it out and seek medical evaluation. Recovery requires patience and a gradual return to activities, and prevention through proper equipment, technique, and environmental safety is crucial. These principles apply whether you're an athlete, parent, coach, teacher, or just someone concerned about brain health. For more comprehensive information about concussions, visit trusted resources like the CDC's Heads Up program, the Brain Injury Association of America, or consult with healthcare providers specializing in sports medicine or neurology. Remember that concussion awareness is constantly evolving as research advances, so staying informed with current recommendations is important. If you found this information valuable, please share this video with friends, family members, coaches, and others who might benefit. By spreading accurate information about concussion recognition, treatment, and prevention, you can help create safer environments for everyone and potentially prevent serious brain injuries in your community.